This is Robert. Robert has a learning disability. He has an appointment to see the screening team. He has brought his purple folder with him. This is a record of Robert's health needs and appointments. It has information in it about Robert. Health professionals can use this information when treating him. Robert is over 65 and today is being screened for an aortic aneurysm. The aorta is the main artery that runs through your body. Arteries carry blood all over the body. Sometimes an artery can have a weakness, and this is called an aneurysm. Screening helps to find that weakness. The first thing that is going to happen to Robert is a scan. The two technicians explain to Robert about the scan, using information he will understand. Robert can ask any question he likes, and they will answer them and tell him what's going to happen.
Okay then Robert, if that's right for me please, what I'd like you to do, just lie yourself down on the bed and also let me see from your belly button to your rib cage.
Robert makes himself comfortable on the couch. He lifts his shirt. The technician dims the lights so he can see the screen better. He then puts some gel on Robert's tummy. This is so the camera can see inside Robert's body. The technician then puts the camera on Robert's tummy and looks at the TV screen. The technician can see straight away if there is a weakness and talks to Robert about what he can see. The technicians have explained to Robert that they have found a weakness in his aorta that is over 5.5 centimetres and he will need to go to the hospital for some more tests. These will be a blood test and 2 other types of scan. Robert is given some information about this so that he will know where to go and what will happen. Robert will be contacted by the coordinator and a special nurse who knows about arteries called a vascular nurse. This will happen on the same day. She will talk to Robert about his lifestyle and help plan for his appointment at the hospital. It's early in the morning and Robert has come to the hospital for his tests. The receptionist tells Robert to go to the outpatient department, which is on level 2 of the hospital. This is for the blood test. When it is Robert's turn, he is called into the clinic room to have his blood test. Robert meets the nurse who is going to do his blood test. She makes sure that Robert is happy and comfortable whilst the test is happening. The results of the blood tests are important. The doctors will need to know the results of his tests before he goes for his CT scan. Robert may have to wait whilst these results are checked. Robert now has to go to the vascular laboratory in the hospital. This is the department that specialises in arteries and veins. When he gets there, he will meet with a radiologist and have another scan. This is called a carotid duplex scan, and it is a scan of Robert's neck. It is very similar to the one he had of his tummy, and it doesn't hurt. Robert now has to go to have his last scan. The scan is called a CT scan. Robert meets with the radiologist, who is the person who is going to do the CT scan. Robert will lie down on the couch in the middle of the scanning machine. He may hear some noises and the radiographer's voice as the scan happens. The machine will move back and forth, and he will have to lie really still and relax. Just for a short time, he'll be left in the scanning machine on his own. After the CT scan, Robert will go to the outpatients department, where he will have an appointment to see a doctor who is a vascular surgeon. Robert is talking to the vascular surgeon about the results of his scan. If Robert is healthy, he could be offered an endovascular aortic repair, sometimes called an EVAR. This is a keyhole procedure where the doctors use special tools to look inside the body and fix the aneurysm. Robert would have to stay in hospital for 1 or 2 nights. If Robert cannot have an EVAR, then he will be offered an open repair operation, which means doctors would have to open up Robert's tummy to fix the aneurysm. Robert would have to stay in hospital for a couple of weeks. Robert and the surgeon would choose the right operation to fix his aneurysm. Robert understands everything that the doctor has told him and knows that the hospital will phone and tell him what day to come for his operation. Robert is happy he came for his screening because it may have saved his life.